Welcome back to Between Two White Coats, a podcast designed to help you be the healthiest version of yourself. I'm Dr. Michelle Plaster, a family medicine doctor.
And I'm her co-host, Amber Foster, a family nurse practitioner. In our combined 30 years in medicine, we've seen a lot.
We're discussing key issues surrounding health and wellness, answering some of our biggest questions, overcoming health obstacles, and giving patient-centered advice in hopes of educating you and providing the tools you need to live a healthy life.
If you find our podcast helpful, please consider subscribing so you don't miss an episode. And don't forget to leave us a 5-star rating and review. This will help other people find our podcast.
Thanks for joining us. We look forward to serving you.
Hello and welcome back to Between Two White Coats. How are you today, Amber?
I'm good. How are you?
I am great.
How's your gut feeling?
That is, what's my gut say about this next podcast episode? And so we are going to talk about the gut.
Yes.
This is near and dear to Amber because she has celiac disease and her gut is jacked up a lot.
You know what I was thinking, which is totally, like, this is me going off the rails, but you know I do that often, is we have a really pretty kitchen downstairs, and I was like, it would be really great to do a podcast episode about like a gluten-free gut microbiome, since that's what we're talking about. Pretend that we're going to cook or something.
Oh, yeah, because we don't cook.
But our kitchen downstairs is and it's so pretty down there.
Yeah.
And like we could prepare something and
our
like
wellness
we
center
could
has
be
this
like
really
Elizabeth,
nice...
like take some pictures of us in the pretty kitchen downstairs. We're talking about microbiome and gut stuff.
Who are these people that we always reference in this podcast? Elizabeth is in charge of marketing, but she also just does whatever we ask because she's awesome. Got us hair and makeup for the podcast.
Whoop, whoop.
So if you listen to us,
go look at us today.
You need to go like us on YouTube because we look better than we used to.
The back of our hair is done, which is something that Shelly and I do not often do.
No,
the back of our hair.
I'm watching the YouTube one day and I'm like, oh my gosh, I have a back to my head. And I should probably do my hair on the back when we're going to actually show the back of my hair. Like
today
so
we have
then
the back
I
of our
have
hair
to just
done.
make sure I sit to where only the front shows. And sometimes we also mention our dear friend Caleb, who is our podcast producer. So shouts out to the people behind the scenes.
And Caleb has to listen to us multiple times because he has to edit us. Bless his soul.
Bless his soul. Yeah. Our husbands are like, better you than us, Caleb, better you than us.
So back onto the rails.
Right.
We were talking about microbiome, but I think that would be fun for our
topic
guts.
is microbiome.
Yes.
And cooking is a big part of what happens in your microbiome.
Yeah.
So, actually the idea is microbiome. What the heck is that? The microbiome is what are the living organisms that are in our body. The living organisms that are on our skin, that are in our gut, digestive tract, which is the entire space from mouth to anus, is lined with all of the bacteria, the fungus, the viruses, what's in our mouth, lots of important stuff there. I'm going to say all the words that non-medical people go, ooh, in the vagina.
In the vagina.
The microbiome gets jacked up postmenopausally in the vagina.
Yeah.
We know as we age, women age, there is increased urinary tract infections. And so increased urinary tract infections really happen because of the destruction of your microbiome in the vagina.
Yeah. Which people don't realize. I'm like, use some estrogen cream.
Yeah.
And honestly, it fixes a lot of chronic UTIs in older women.
So a lot of our hormones are maintaining our microbiome. They are helping the good bacteria, the good fungus and virus, the stuff that's supposed to live there, to outweigh the bad. And so our hormones are helping to maintain the natural environment in the vagina. And when you are postmenopausal, then you lose that natural environment, the secretions that happen, the estrogen is kind of forcing all of that to happen in the vagina. Things dry up, the bad bacteria start to thrive, the good bacteria are dying, and you have more issues. Yeah. You get yeast infections, you get UTIs, you get a lot of other
bacterial
things.
vaginosis.
So the microbiome is really all of this stuff that lives inside of us that stays in balance. Thousands and thousands, millions and trillions of bacteria that live inside of us that we have to keep in balance to stay in good health. The microbiome is responsible huge for immunity, especially in the lining of our gut. This is where we fight things off. The microbiome is responsible for digestion. So a lot of people who have bloating and they're always talking about being bloated, this is a imbalance of your good and bad bacteria. You have to keep these good bacteria healthy and happy and thriving, or else your immune system will suffer, your digestive tract will suffer, nutrient production. The microbiome is responsible in our gut for breaking down the food that we eat so that it can become digestible. So when we get it to its smallest possible part and move it into our bloodstream, if you don't have a good microbiome, you're going to be malabsorptive. You're not going to be able to digest what you eat. So you may be eating all the broccoli and carrots in the world, but you're not getting all the vitamins and minerals that you need out of it. I really believe that one of the things that's happening in society, to especially in America, to destroy people's health, is that our lifestyle does not support our microbiome. Yeah. This, microbiome sounds like it's a new phrase. It's always
fancy.
Existed in humans, but it's not something our grandparents had to talk about. When you were eating the stuff that you grew on your farm, or the stuff that you hunted, you weren't destroying your microbiome. We destroy our microbiomes all the time.
That's why I'm not drinking from plastics anymore.
Yes.
I'm really trying hard this year.
What is the stuff we're putting into our body that helps destroy the normal flora of our body? And what is the one thing, as the provider who does the most pediatrics in our practice, what is the one thing that the parents come in and they're like, hey, my kid has cold symptoms and I desperately need this, and please give it to me or else I'm going to blow you up with a bad review on...
I have very sweet patients, so they don't say that to me, and hopefully they trust me enough. But antibiotics, it's...
Yes.
And honestly, I have patients, and there are some patients that, yes, I do believe and trust, and I'm not saying I'm not being hateful when I say this, but, just call me in a Z-Pack, call me in. And I'm like,
I don't need to see you, and I don't need to bring my kid in. Yes. I just need you to call me in a Z-Pack.
And I just want to be like, no, because it destroys, it also destroys things. And a lot of things are viruses, and I'm not saying that you don't need to be seen. Let me help you make the decision if you need an antibiotic.
But let's not take an unnecessary antibiotic, because this is what people, I think, are misled to believe, that taking an antibiotic is harmless. And then we doctors took an approach of, hey, we don't want to prescribe antibiotics that aren't necessary because it creates resistance patterns to antibiotics. So then we start having conversations with people that are like, hey, you know what? In 20 years, this antibiotic's not going to work at all because we overused it. And there sits a young mother, first-time mother, who's like, I'm not really worried about what happens in 20 years.
I'm not like that.
With zithromycin, I have a sick kid and I want you to make them better. And so please hear us when we say it is no white coat's intention to leave you or your kid sick when we could have given you something to help you.
No, not at all.
It is that if it's not going to benefit you and it is going to potentially cause harm, then why would we do that? So first, let's discover whether the infection you have is even bacterial. If it's not bacterial, it's not going to get better with an antibiotic. Mm-hmm. If it's a virus, if it's a fungus, you're either going to get better on your own or need something different. Then let's try to figure out what is the right antibiotic. Because when you call us and say, I have a UTI, listen, when people call and say I have a UTI, I believe them. UTIs don't feel and resemble a lot of other things. Yeah. If you've had a UTI before, you kind of know when you have a UTI. And so it's not that I don't believe you. It's not that I want you to pay a copay. People will sometimes oh, you're just trying to get money out of me. No, it is okay. I don't want to see people unnecessarily. Need a urine culture. And this is why. So I'm still going to give an educated guess, and I could have done that over the phone with what antibiotic to prescribe you for a UTI, but I'm going to send off a culture. And in day 2, 3, I'm going to get back that result. And now even for upper respiratories, we have PCR tests that we can do, and we'll do a nasal swab or a throat swab and send that off. And next day, we'll get back what you have. Yeah. So maybe you've taken 1 day, 2 days of an antibiotic, and then we get back the information and it says, yes, you do have a UTI. Here's the infection. Here's the exact bacteria that you have. And here's what's going to work. And I go, oh, that's not what I chose. I didn't realize that was the bacteria you were infected with. There's no way I could have known that. All the bacteria present with the same symptoms. And so I'm just going to have you take that unnecessary antibiotic that we made an educated guess wrong for 2 days. And then I'm going to call and say, hey, let's switch out because this is the one that's showing it's going to work. And then let's take this one now that I'm absolutely confirmed for 3 days, for 5 days. And then we haven't done a whole 7-day course of one antibiotic, stripped out all of your microbiome, and then go, oh, you didn't get better? Well, I don't have a urine. I don't know why you didn't get better. Let me guess at the next one. Let's take 7 days of another one. Oh, you didn't get better? Oh, let's take 7 days of another. Now I'm having to go with the really strong ones.
Yeah.
So what does the recovery of an antibiotic look like? Whether it's a necessary or unnecessary antibiotic, it's killing the good bacteria as well as the bad. And so the recovery is 2 to 3 months after a 7-day course of an antibiotic, not the broad spectrum, not the heavy hitters. It's going to take 2 to 3 months to rebuild your gut. You can have bloating, you can have diarrhea, you can have feeling generally lousy. It can strip out your immune system, so then you're more likely to get sick with
Secondary
the next
infection.
thing. Yeah. And so why would we do that to you if that antibiotic is not necessary or not what you need? It does harm. The risk may far outweigh the benefit of taking an antibiotic because the antibiotic destroys your microbiome. And then if we give you a broad spectrum antibiotic, which is like, hey, this is the heavy hitter, it kills just about everything, then that can strip things down for 6 months. There were some studies that found, and it's difficult to have studies that find this because people don't follow human subjects for 3-5 years. But there were some studies that found that when people did course after course of antibiotics, so that scenario I just gave where it's, oh, I gave you one on a guess on the telephone and it wasn't right, so then I guessed on another one, and you did 3 full rounds of antibiotics, it can take 5 to 7 years to get your microbiome back after that kind of repeat.
Which is crazy.
Or the people who have a really bad resistant infection and they have to do IV antibiotics for 3 months, or we're treating you for Lyme's disease and it's 21 days of antibiotic. It can take years to get your microbiome back, and things are disrupted and you get sick more often and you have bloating and you have diarrhea and you have other issues.
And also like serotonin's made in the gut, and people don't realize that, like 90%. So like
yes,
that can also affect your mental health.
Yes, it can affect your mood. It can cause so many problems. So knowing an unnecessary antibiotic is probably the worst thing. Any antibiotic is going to be a problem, but if the benefit outweighs the risk, then we have to do it. Yeah. But anytime you take an antibiotic, please start working immediately to rebuild your microbiome. So that means when you start the antibiotic, start a probiotic.
Yeah, I'll tell patients
stay on that probiotic for 2 months.
Yeah. Yogurt, like go ahead and take yogurt while you're taking the antibiotic, or take a like a powder or pill
or a pill
something.
Or a capsule. Yeah. And I'll tell people, if you've had to take a 7-day course, know that it can take 2 months to rebuild your microbiome. I'd go ahead and take a probiotic capsule for 2 months. Yeah. And only because it's hard to eat yogurt every day for that long, and there may be more sugars and other things depending on what they choose. We also destroy our microbiome with our diet, knowing that a lot of our microbiome exists in our digestive tract. That when we eat processed foods, when we eat refined sugars, we are feeding the bad bacteria, and we are feeding fungus, and we are feeding yeast. Yeast thrive on sugar. Diabetics know when their sugar's staying high, they get repeated skin, vaginal yeast infections. And so if you have all this refined sugar in your gut, you are going to create a scenario where you are feeding the bad bacteria, not the good, and you get in this imbalance. So be careful about your processed foods, and be careful about your refined sugars. And if you're having a lot of digestive issues, if you're getting sick repeatedly, a good thing to try would be, let's start trying to rebuild our gut. And in the meantime, don't feed the bad stuff. So strip out the refined sugars and the processed foods while you try to build your microbiome. Stress can destroy your microbiomes. Our pillars of health, stress management is an important pillar of health. So you've got to really manage your stress, because like you were saying, the chemicals that help balance things get out of balance.
My kids call it bubble guts. We call it bubble guts. Like when you're nervous, you get like, you just kind of got that uneasy feeling.
Yes.
And that's why we call it bubble guts, because where does it hurt?
And
in your
creating, you're creating an environment in your stomach that feeds the bad bacteria and starves out the good, and you get this imbalance. And then genetics is really interesting, that your microbiome is determined by your genetics, helped determined by birth and the mother who carried you. Your microbiome is also determined by where you live and your environment. when we go to foreign countries where we can't drink the water, but the people who live in that country drink the water just fine, it's because they have a microbiome that supports against the bacteria that they're ingesting, and they're in balance. And we don't have the microbiome for that. If you live somewhere for many, many years, you may develop and have changes in your microbiome to where you tolerate different things and have a better balance. So it's incredible how our bodies kind of prepare for our surroundings. So recognizing there are ways that you hurt your microbiome, I think antibiotics is first and foremost. Refined sugars, processed foods is right up there. Not managing your stress, all ways that you're destroying your microbiome, which is so important for your health across the board. And then we want to rebuild the good bacteria. And so Amber and I have talked about what supplements we take. We both take probiotics daily. We use the pure encapsulated GI probiotic. The probiotics are the good bacteria. A few things you need to know. I recommend probiotics for everyone on an American diet because it's just hard.
It's the American diet.
It's the American diet. And we have to kind of support against that. And so there are a few things I like to remind people on probiotics. Remember, this is live bacteria in these little capsules, and there are thousands of options of these bacteria. So if you are trying to support, maybe you get recurrent vaginal infections. Maybe you have a GI tract that's been stripped out because you've taken an antibiotic. You can Google search, which probiotics do I need to rebuild that? Or what products will rebuild that. Not all probiotics act in the same place in your body. So select the probiotic that you need for what your specific issue is, or the variety of probiotics. I am constantly trying to make sure that my gut is healthy. So I use the GI probiotic by Pure Encapsulated. It has all the different strains of bacteria that are good for your gut, that are necessary in your gut. So there are tons of different bacteria, and you want to replace the ones that you specifically need. Also, remember that these are live bacteria. So if they have sat at the warehouse and 300 degrees, it's going to fry them, and they're not going to be valuable. So making sure that you buy these from places where they've been handled correctly. If you're not quite sure, some probiotics are stored in the refrigerators, and then you know that it's live culture and it's good. So being smart about which probiotics you take if you're using a supplement. Also, probiotics can be replaced in your diet. Mm-hmm. Yogurt, you mentioned. Kefir. Kefir is a liquid type yogurt that you buy in the refrigerated section of most grocery stores, and that has tons of probiotics. A lot of people will talk about sauerkraut and kombucha, and there are not as many strains and probiotics in this, and we're sort of like, is this having a lot of probiotics? And by itself, it's probably not enough to really rebuild a gut that needs rebuilt, but it's going to help some. And also then prebiotics are the things that help feed the bacteria and keep the bacteria healthy and thriving. And that is high fiber foods. High fiber foods are your crunchy fruits and vegetables, your whole grains. Garlic and onions are great prebiotics. So if you like garlic and onions, we said lack of good bacteria in your mouth can cause bad breath. Probably the garlic and onions can as well. But it will help be good prebiotics. There are lots of different things that you can be ingesting that help feed the bacteria. So you've got to replace the bacteria. You've got to create an environment and nourish the bacteria. And these bacteria are super necessary for your health and wellness. So the microbiome is a very complicated, and it sounds like, a really fancy thing, but it's really the fact that we have good bacteria.
And we want to keep it good.
We need to take care of them. We need to create environments for which those good bacteria thrive and the bad bacteria don't take over. We do that with our diet. We do that by living a healthy lifestyle and managing our stress. And we do that by taking and eating the pre and probiotics. So respect your microbiome. Do what you have to keep a healthy microbiome. If you're getting sick all the time, if you're having lots of digestive upset, really consider whether you might need to put some energy into rebuilding your microbiome.
We like to leave you on a good note. Here's today's Tell Me Something Good. Something great is first responders. These are the people who show up when nobody else wants to show up. The people who run into buildings when everyone else is running out. The
the people who protect us and help us and have chosen to spend their life doing good for others. I am so grateful for first responders. Thank you to anyone who is out there and is a first responder. Thank you for joining us today, and until next time, take care of yourself.